this so that we can share the video for those who registered and were not able to attend. So this is our 2023 campaign kickoff meeting. Thank you so much for attending. Just a few housekeeping notes for you. If you aren't, for those of you who aren't speaking, please keep your microphones muted so we don't have any interruptions. Like I said, this meeting is being recorded. We weren't able to get the live stream started to Facebook, so unfortunately that will not be available for this meeting. In a few days, we'll send the slides and the recording via email to those who registered. If you know somebody who wasn't able to attend, we'll be able to send those to you and you can share those with anybody else in your network. There will be a Q&A time after our speakers present, and we'll have a time afterwards. If you do have any questions, feel free to share them in the chat box. And we will have a survey that we ask you to complete at the end of this kickoff meeting. I do have, like I said, if you did not get the poll sent to you, please share what county you're from in the chat. I'm going to share another poll for you right now, if you don't mind to answer it. What school, organization, or group will you represent as a champion this year? And then when you're finished with that, just because it is the season to practice gratitude, please share with us something that you're grateful for this Thanksgiving season. I'm really thankful. For those of you who don't know, I work remotely and live in Ohio, and it is snowing outside right now. And so I'm really grateful for that snow. And I'm thankful for all of you being here today. For those of you who don't know, your campaign coordinators are myself. I'm Tiffany Thomas. I'm the Program Manager of Education and Outreach at the Mental Health Association of Maryland. Unfortunately, Tara Wetherell is having some technical difficulties with her computer this morning, and we're trying to get her in, so hopefully she'll be able to join us once we get those resolved. But she's the Social Marketing and Outreach Manager at Maryland Coalition of Families. Many of you know her. She's a fantastic colleague of mine. I love working with her, and they do great work at Maryland Coalition of Families. We have many campaign partners that have dedicated their time and passion to support our efforts with the campaign. The Behavioral Health Systems of Baltimore, the Maryland Department of Health, Maryland Association of Non-Public Special Education Facilities, also known as MANSEF, Maryland Behavioral Health Integration and Pediatric Primary Care, also known as Maryland BHIP, Maryland Department of Disabilities, Maryland State Department of Education, and the National Center for School and Mental Health. We are so grateful for our partners that have worked with us for many, many years, and for all the work that they do across the state. So I just want to shift the focus to lead up to the two speakers that we have today. For those of you who are familiar with our Surgeon General, he shared a quote this year that I thought was really aligned with our focus for the campaign this year, which is supporting not just the children that we love and care about, but the families that they are a part of. He says, if we seize this moment and step up for our children and their families in their moment of need and lead with inclusion, kindness, and respect, we can lay the foundation for a healthier, more resilient, and more fulfilled nation. Really love those words. They're very powerful, and they really align with the focus of what we're hoping to do with the campaign this year and the years to come, which are to support not just the children, but the families that they come from, and make sure that they have the support and resources that they need. In the Surgeon General's report that came out this summer, he discussed the current mental health crisis of minority and marginalized young people and the condition of mental health during the pre-pandemic, during the pandemic, and post-pandemic. And some of the highlights from those were that during the pre-pandemic, mental health challenges were the leading cause of poor life outcomes among young people. And during the pandemic, that was the severity of that was exposed. The crisis facing young people, which placed them at a higher risk. And many of us know that and have seen that. And post-pandemic, evidence shows that marginalized populations continue to be disproportionately affected. So we have a lot of work to do, and we'll continue to see a lot of that unfold as the years come. If you're interested in seeing and reading that report, I'm going to drop that link in the chat for you there. It is a very, very powerful report. So what can we do to support children's mental health? Encourage systems that support. As many of us know, early intervention is very powerful and very crucial to supporting children's mental health, encouraging positive mental health, which is important for reducing risk for mental health challenges, empowering families and communities, equipping them with information, tools, and supports to recognize when and where to access care, and then engaging others to reduce stigma. Beginning those conversations about mental health and mental wellness often to talk about it. And that's really how we're aligning the campaign this year, encouraging the systems that support by aligning with clinicians and with the people who can help care for families and children, empowering families and communities with the information and tools that they need, and then engaging with engaging with schools and community organizations to help reduce stigma. So today you're going to hear from two speakers. We're going to hear from Megan Crosby-Buttinger, who's from Maryland BHIP, and she's going to be talking about the systems that support. And we're also going to hear from Tanya Meck from Maryland Coalition of Families, who's going to talk about the families and family peer support. And so I'm going to introduce Megan, and she's going to share with you about her programs and the importance of clinicians in the family unit. So Megan, it is off to you.
Wonderful. Thank you so much for the introduction. I'm really pleased to be here representing Maryland BHIP and sharing with us. Okay, and I think I'll need you to pull your slides down, Tiffany, just so I can pop mine up.
Okay.
There we go. All right, bear with me just a moment. Oops. All right. Wonderful. There we go. So as Tiffany mentioned, I'm the program director for Maryland BHIP. Just want to share with you a little bit about what BHIP is and what we do. So Maryland BHIP stands for Maryland Behavioral Health Integration and Pediatric Primary Care. So that's a big mouthful. That's why we go by BHIP. And our primary focus is really in supporting primary care providers that serve children here in Maryland. And so we do that in a number of different ways. We offer a telephone consultation warm line. So that is a peer-to-peer support warm line where pediatricians and other pediatric PCPs can call and speak with a child psychiatrist, psychologist, or social worker on our team. They can ask us diagnostic questions. They can find out about recommended tests, assessments, or medications. We know that primary care providers are doing a lot of mental health treatment for children here in Maryland, and so we want to offer them that support. Through that warm line, they can also access our resource and referral database. So we have a social worker who takes the phone calls, and she's able to offer resources and referrals that the primary care provider can share with the families that they serve and help them get connected to specialists and other community resources when needed. We do an awful lot of training at Maryland BHIP. We offer trainings to primary care providers, but we also have other types of professionals join as well. We offer training to emergency medicine professionals who are treating children more and more in our crisis centers and emergency departments across Maryland. We also have a number of school-based mental health professionals that join our trainings and other private mental health professionals across the state. We are really lucky to have our partnerships with Salisbury and Morgan State University, and I see some of those partners on the call here today. We have a social work internship with those universities for their students who are completing graduate work in social work. And we co-locate the students into pediatric primary care facilities and provide training and support to them during their internship year as they're preparing to enter the workforce and serve children here in Maryland. We also offer a Project Echo, which is a little bit more intensive, ongoing training for primary care providers. And this is more of a peer support, group and case consultation group where providers can sign up. They join a monthly call. They provide peer supervision to one another, and we have some of our team on the line who can help as well. And then we typically will have a brief didactic at the end of that where they're learning about a mental health topic that they've expressed interest in learning more about. Finally, we do offer some direct telemental health services. So there are times where, especially in more rural parts of the state or where there's other specific challenges that we're just not able to find a good referral resource for a child. And we do offer some brief psychiatry, psychology and counseling through that mechanism, and then connect them back with care in their local community. So those are kind of all the different services that we offer at BHIP. As I mentioned, we're really lucky to have all these community partnerships. We're supported by the Maryland Department of Health, the Behavioral Health Administration, and our staff is at University of Maryland, Johns Hopkins, Salisbury, Morgan, and we also have a fairly new partnership with University of Maryland Eastern Shore as well. And we also have community partners with the Maryland Coalition of Families, Mental Health Association of Maryland, Maryland Academy, American Academy of Pediatrics, and others. And we're long-standing partners in the Children's Mental Health Matters campaign. This picture was taken a couple years ago. I know about 10 years ago, I participated in a flash mob in the Inner Harbor and things like that, but we're always trying to champion this cause. So it's an honor to be here today. So just wanted to set the stage a little bit for the kickoff campaign and talk a little bit about the impact of the pandemic, trends that we're seeing in the field, the importance of overall family wellness and supporting child mental health, and finally, just some steps that families can take. Okay, so we know, all of us probably know anecdotally about the impacts of the pandemic. There have been a few studies out. So one study saw that since March 2020, 27% of parents were reporting worsening for themselves as parents or caregivers, and 14 reported worsening of the behavioral health of their children. We also know that the Annie E. Casey Foundation puts out a Kids Count data book each year, and their latest one, they looked at differences between 2016 to 2020 and saw a 30% increase after the pandemic began in children ages 3 to 17 who had anxiety or depression that was diagnosed by a provider. This study in particular really wanted to look at impact on both children and the family and how they were functioning overall together. So the participants in this study were 384 parents from 3 different states. So they had parents and families in Texas, Delaware, and Pennsylvania. And they looked at pre-pandemic data from 2017 and then after the pandemic began. And they were looking at some really specific things. They wanted to track parental depression and anxiety. They also wanted to look at in families where there were 2 parents, look at how was that co-parenting relationship quality. And then finally, they were looking at the child's internalizing symptoms, which are things like depression, anxiety, sadness, worry, and externalizing symptoms, which we think of as more like behavioral symptoms. So what they found was that there were large deteriorations from before and after the start of the pandemic in every area that they measured. So parental depression, parental anxiety, the quality of the co-parenting relationship, right? We know that put a strain on those relationships. And also children's symptoms, they're internalizing symptoms like their worries, their fears, their sadness, and also behavioral difficulties. They took a look at some different demographics to see who was particularly at risk, and they found that mothers were the most at risk, and also families who had lower levels of income. And so they really saw this as a call to action. This was a quote from their report. They said results indicate a need for widespread family support and intervention to prevent potential family scarring that is prolonged and intertwined with individual mental health and family relationship problems. So they really see that this has a big impact that's going to be, long-standing if we're not able to provide support that parents and children and families need as a whole. So we know, so this is from the U.S. Department of Health and Human Services website. When families are healthy, safe, and economically stable, their children's health and well-being can thrive. So we know that a parent and child's mental health are connected for a number of different reasons. So some of the things we know, if a parent is struggling with their own mental health, it can make it more challenging for them, right? Like if you're struggling on your own, it's hard sometimes to meet the needs of your child, or you can just experience more stress in meeting the needs of your children. Caregiver strain. So if your child has challenges or mental health needs, it can be very difficult for the family over time. It can be stressful for the caregivers. And also there could be shared vulnerabilities. So for example, you may share some genetic traits that make you more vulnerable to something like depression. You may have shared experiences such as a traumatic event, or maybe some other risk factors, such as low income or lack of access to resources that you share with your child that can impact your family as a whole. So when we think of supporting a child's mental health, we think about the individual clinicians on the treatment team that can support the child's mental health. We think about the family, and then we also think about the greater community at large. So that can be, family and friends, that could be the school community, and then also just our community at large here in Maryland. So just wanted to share some steps that families can take in trying to, gain support for their child and themselves and their family. So we know that the primary care provider is a great resource for families. This may be a pediatrician, but it could also be a family physician or nurse practitioner or physician assistant that provides ongoing care for your child. And mental health professionals, of course, you can access counseling, psychiatry, and psychological services. There are other types of specialists as well that can provide support, depending on what your child's diagnosis is or what types of treatment they need. You might engage other types of professionals, such as a speech and language therapist, occupational therapist, or other types of medical professionals might be part of your team. We know that teachers are an important part of the team, right? When supporting children, it's important to engage them and let them know what's going on. And then also the school in general. So there are a lot of great school-based mental health resources and other types of special education support services in our schools. And so reach out and find out, get connected to the school counselor, school psychologist, and the student support services team in engaging support for yourself and your child. It's also very important to take care of yourself. So it's kind of like, I talked with a couple of people before we hopped on the call today that have been flying recently. And when you're getting on the airplane and they're going through all the safety, and they always advise you, put your mask on yourself before helping your child or someone you're traveling with. It's so important for parents to have the opportunity to seek support for themselves. So on a core, everyday level, that just might be your social support network, your friends, your family. making sure to set aside time to take care of yourself and do the self-care you need. This woman here is doing some meditation. That's one of my preferred self-care activities. There's also some really great support groups here in Maryland and also online now, especially. That's one positive that came during the pandemic, is that there was a lot more online resources. So it may be helpful to join a support group, maybe other parents that are coping with a similar diagnosis as your child has, for example, or in a similar situation. Respite care is also important, both formal and informal, right? So maybe having a trusted relative care for your child so you can have a break. There's also formal respite care that can be set up to help give you that break that you need to prevent burnout and caregiver strain. And then sometimes parents need their own treatment as well, right? They might need to see someone about counseling or medication to support themselves so that they can have their own wellness and be in a better place to care for their child. And finally, one of the next things that we're going to be talking about today is just reaching out for community support. Here in Maryland, we have some really wonderful mental health advocacy organizations. And so I know I'm going to be turning it over in just a moment here, and you'll learn more about some of those efforts. So I know about the Youth Peer Support Program, Taking Flight, for young adults, and then also family peer support and navigation, both through the Maryland Coalition of Families. There's some references here if you'd like to look at any of the studies that I talked about today. I just want to thank you for having me join. It's such an honor to be part of this campaign, and I would be happy to take any questions that anyone may have about BHIP or any of the things that I shared today. Can you show the last slide with the references? Sure, let me go back. Okay.
Thanks so much, Megan. I appreciate your time, and
Sure, I'm happy to see comments. We can move on to the next piece.
Yeah.
And I'm
if anyone
your questions at the end too.
Yeah, if anyone thinks of any questions, feel free to drop them in the chat, or we'll have some time for questions also at the end. So we're going to move on to Tanya Meck, who is a certified family peer support specialist and a parent. She serves Baltimore City area, and so I'm going to pass it over to Tanya. Sorry about that. To Tanya.
It's okay. Thank you, Tiffany. It's truly an honor to be able to present during the kickoff today, so I want to thank you. Like Tiffany said, I am Tanya. I'm a family peer support specialist for Maryland Coalition of Families. I've been with Maryland Coalition for 2 years now. Actually, I think my anniversary is today. I am a mother of 2 children who have multiple diagnoses for mental health between the both of them. So for my first year, I was a family peer support specialist for young children with mental health challenges, as well as youth that were involved with the Department of Juvenile Services. Recently, I transitioned into our adult mental health program, but I still do support my caregivers that have young children. So, let me go back. So about Maryland Coalition of Families. Maryland Coalition of Families is a statewide nonprofit offering family peer support services at no cost to families, caregivers, and loved ones of individuals that are experiencing behavioral health challenges. We serve parents and caregivers of children and adults with mental health needs, any loved one that is struggling with substance use or with problem gambling. I do want to say that most of the time, or a lot of the time, these families have children and adults that are challenged with multiple needs. We do have many grants. So in that case, our family peer support specialists would collaborate with one another and help the family through both grants or however they're needed. So what MCF does is we connect families to resources and services as well as to each other. We support families by helping them to navigate the health and legal and educational systems. And we empower our families to advocate for themselves and for their loved ones through education, which is our ultimate goal, is to have the families be able to advocate and guide through the systems themselves. So how does family peer support help? Family peer support connects families who have similar experiences. Each of our staff have either lived experience caring for a loved one with mental health needs or have experienced herself, and that's mental health as well as substance use, problem gambling. We bridge the gap between families and the mental health services and systems. And we help families feel less isolated and give them a vision of a better future. We like to say we meet the families where they are. We're not trying to push them to do anything they don't want to do. Ultimately, any decision made is made by the family. We're just here for suggestions and support. So how we support and connect and empower our families is we connect them to resources, treatment options, and other services. We collaborate with other agencies and gain partnerships. We advocate for our families. We can go to court with our families. We can be on IEP calls. We can be on DSS calls. Although we may not be able to speak directly, we can be there as their support to help answer any questions or guide them. And then even as support to maybe calm them when they become overstressed. We teach self-care and resiliency, provide workshops, trainings, and support groups. And ultimately, we help with the goal settings and action plans. So the benefits of the peer support is we increase the sense of collaboration, sense of self-efficiency, practice of self-care, which has become very, very, very important, as Megan spoke about that a little bit in her presentation. Understanding of the systems and services. A lot of our families have been let down in some instances with the systems and kind of do not want to go back in that direction. So we try to give them positive outlooks. The empowerment to take action, and then it decreases internalized blame and feeling of isolation. These are just some of the ways that we are able to assist the families. Okay, our family peer support specialists help families who have children with impulse control and conduct disorders, including ADHD and oppositional defiant disorder, mood disorders, including depression, mood dysregulation disorders, and bipolar, anxiety and trauma-related disorders, including PTSD. These are some of the most common diagnoses that we see in our families. And while there are others, you do not have to have a diagnosis in order to receive services or support. So last week, I was able to have a workshop for my families. I have a monthly support group called Clearer Skies. For the most part, it is open. I like to have events every couple of months for my caregivers. This one, actually, you see the caregivers, but the children were actually involved too. We practice Zentangle, which is an art therapy, and they were able to, be creative while kind of letting their mind run free. So these are just some of the, these are just some of the pictures that we were able to take. Self-care is very important, and we try to promote it as much as possible. So I'm gonna shortly tell you about two of my families that I'm currently supporting. Right now I have a dad who is a 60-year-old retired Vietnam vet. He was also, once he was out of the service, he got involved into drugs and substance use and was incarcerated. He now has a 16-year-old daughter. She's going through the normal teenage stage of mood swings, trying to find herself, but she does smoke marijuana. Dad, when I talk to him, is very upset that she's smoking marijuana. She's going to any meetings with him, but she continues the use. However, she is doing well in school. She has her own job. She's paid for her own car, went to driving school, has certification in lifeguarding, and she's doing great other than this challenge of smoking marijuana. So what I told Dad is, instead of focusing on all the negative, this one negative, to encourage her and praise her about the positives. So he finally did, and now they are actually like doing lunch together, and they're talking more, and they're gaining that positive relationship that I think both of them were kind of yearning for, but didn't know how to go about. So while it's not all mental health, I was able to mend a relationship that was not going in the right direction. Another instance is I have a mom who suffers from mental health challenges herself, but she has her older son who is schizophrenic with autism and PTSD, as well as a younger son who has mental health challenges also. She was going through the systems and she couldn't find a residential treatment program for her son that was in her area. The son had been hospitalized for months. And she didn't know what else to do, so she left him at the hospital. Well, ultimately, he went to the biological father, who he hasn't seen in years. We went to a DHS meeting. She ended up losing her oldest and was frantic. She didn't know what to do, so I told her to take that weekend off because there was nothing she could do. I knew it was hard for her. So Monday we talked and she started looking for a stable house. She put in an application. She went back to her old job to ask for her job back. About 2 weeks later, she was approved for the housing. She was approved for her job. And now she can focus on getting her son back because now she has all the necessary things in place to have her son in a safe environment. A lot of times with Maryland Coalition of Families, we do navigate the systems, and sometimes, the legalities of their situation, but we're there a lot for emotional support. It's a judgment-free zone. We've been there, maybe not exactly in a situation, but we've been in a situation that is similar. So we can understand where they're coming from. And I think that's what makes us so special and unique, is they don't feel judged, they feel comfortable because we've been there. So I think that's one of the greatest things about working for Maryland Coalition of Families, is overcoming our obstacles and be able to help someone else do the same. So to learn more about Maryland Coalition of Families and our support groups, you can go to www.mdcoalition.org. You can learn about our support groups that are local and statewide for parents, caregivers, and others. Our educational opportunities, one of our variety of topics, and that's active parenting classes. We have IEP workshops, workshops on ADHD and substance use. We have Narcan training. And then we also have our social media and blogs that talk about mental health topics, including crisis services, health insurance laws, and more. And if anyone has any questions, I will be pleased to answer them. And that's it.
Thanks so much, Tanya. We are so grateful for the work that you do. You are the boots on the ground, and are grateful for everyone else at Maryland Coalition of Families who dedicates their time and lives to supporting families. Does anyone have any questions for either Tanya or Megan about the work that they do or the services that are offered by either one of their organizations. If not, what
I
areas?
see a few.
Yeah, Mary is asking Tanya, what areas do you hear are the biggest gaps for families at this time?
So other than housing insecurities, which we can provide resources, but as many know, there's not many out there at the moment. But I see a lot of parents trying to get their child into treatment, like residential treatment, has been a little challenging. Also, the criminal aspect, I deal with, like I said, I had some children that were in the Department of Juvenile Services. And the kids are kind of acting out and getting away with that if that's not being too blunt about it. So like the parents don't know where to turn. So it's trying to keep a safe environment while helping their child. That in my family experience, that's what has been the biggest gap between the systems and the family.
So much, Tanya. Thank you so much, Megan. We're going to move ahead. If anyone has any additional questions. Oh, I see a hand raised.
I do. I'm Jacqueline from NAMI Carroll County. And my question is, some of the families that I'm working with, the teens that have been placed in residential homes, we're hearing horror stories. And I just wondered, how do you, as a parent, ensure that your child is safe in the group home that they're in? Two specifically that I've heard of, that I guess it was the support staff didn't have a specific job description and we're sort of running amok, in the homes. And if you have a child, particularly, a female with a trauma background, and somebody shows up in her apartment while she's, in her space, how do you screen that those things don't happen? In this particular instance, the mom is afraid that she's going to be that her girl will be retaliated against because she's spoken up complaints before. And I just wondered, in your experience, how do you manage a situation like that? And how do you know your child is going to be safe in a residential treatment facility? And I know it's a big question with lots and lots of questions in questions, but.
I can't particularly answer that, only because I only have one child that has actually been in a residential treatment program. I'm sorry. And he did great. He had a great experience with it. I have not had one that's had a bad experience. Not to say, now hospitals, I've seen that. I've heard those stories. I don't know if anybody else from Maryland Coalition's on the line that has any of that experience where maybe a child, had something like that happen to them. But unfortunately, fortunately, I'm not going to say unfortunately, I have not, so I can't really answer that.
Yeah.
I see, somebody in the chat saying that hiring and retaining qualified staff has been a challenge in the line of work, and finding beds anywhere really is a challenge, and I don't think that, and I invite anybody who may have, thoughts or, professional opinion about this to share. there aren't easy answers to these questions. You know, our children and families are struggling. There is a shortage of qualified staff. There is a shortage of support for children. I don't think there is an easy answer. And so I hear the questions and I see the comments, and I invite you to continue that conversation in the chat. And I don't want to, you know, take it away, but I'm not sure that there is an easy answer that can be offered in this space right now. So it is heartbreaking, you know, it is absolutely heartbreaking.
So I wanted just to comment a little bit, because we do have a program at the Mental Health Association of Maryland, which is our consumer quality team. And what they do is go out and interview patients who are inpatient in psychiatric facilities, both youth and adults. And the purpose of those interviews is to determine their experiences there. And safety has been an escalating concern, specifically during the pandemic. And it's directly, when we looked at the data, I'm not sharing this, I don't have an answer, but what I can say is that the staffing ratios have significantly been, it's been a challenge to retain quality staff. And so whenever there's a deficit in staffing, there's an escalation in what we consider, at least in the data that we're looking at, kind of unsafe behaviors, because there's just not enough support in the system. And so I think, we're working on that as a state level, and the state organizations are interested in the feedback, how quickly, it's a long-term problem, I think, to solve. And I know your question, Jacqueline, was specifically about the residential setting that your particular child is in. But I do know that what we have seen, and again, just to make it a little broader picture, is that sometimes in the facilities where we're interviewing, it's not just unsafe situations that are between the patient and the, someone else in the facility, but also, patient to patient, when folks are not supervised as well as they should be, between staff and staff when they're overworked and very tired and things like that. So, I think when we're looking at some of the pivotal issues, which I know Megan talked a little bit about in her internship program, is making sure that we're getting enough people in the field who stay in the field, because one of the biggest challenges we have is workforce. And I know it's not an answer to the question, and as a parent, I'm sure it's a huge concern about making sure your child is in a safe environment for the purpose of therapeutic healing. So.
I don't think there's an easy answer either. I just wanted to suggest a couple ideas. So for the group home question, I would say if there's a social worker involved, that should be documented so that you could request that they have a change in placement if you don't feel they're safe, but it would need to be documented and reported. And then I saw some questions also about things happening in hospitals, children being discharged without a discharge plan, things like that, and the family having to take that on. I would say in all of those cases, there should be a patient advocate at the hospital who you can raise a red flag with and complain to, and just make a lot of noise about that and say, the hospital is trying to discharge this child without a proper discharge plan, because that is just not an ethical thing to do. And so just raising those concerns and not being afraid to use your voice.
Thanks so much, Mary and Megan, for answering those questions. I do want to move on, and I encourage any chat to continue on in the chat box, and invite everyone who is feeling passionate and wanting to make a difference to participate in our campaign. There's many ways that you can do that. So let's dig into the opportunities that we can take this year. So there are quite a few people who are new to the campaign this year, just taking a look at registration and the information that was shared. So for those of you who aren't familiar with the campaign, it is a collaboration between the Mental Health Association and Maryland Coalition of Families. And the campaign efforts have been going on for more than 20 years. And we've brought together partner organizations, schools, and community organizations with these goals to increase public awareness of children's mental health and substance use challenges, to reduce the stigma surrounding those, to connect children and families with information and tools. And then the last 2 years, we've really wanted to highlight the creative and impactful efforts of those communities doing this good work, and then provide opportunities for our partners and champions to be a role model to others that aren't participating, that aren't aware of the need to make a difference. So this year, there are some great ways that you can take action. You can become a champion for children's mental health. Starting today, registration is open. You can register as a school or community champion. We'll share the links in just a moment to do that. You can utilize our resources and browse our online resource directory that has been updated and refreshed, and will continue to be done throughout the year with some new categories and new resources from other organizations. Starting in January, we'll have a new opportunity for you, which you'll hear about in just a second, to attend Mental Wellness Socials, which is a virtual event, and plan your own awareness events and activities. And that can be done in very, very many various ways. And you can help share the details that you're planning and help us measure impact in your community. So I'm going to pass it over to Tara, who's going to share more specifics about each of these opportunities. And there are QR codes on each of these next slides for you to scan so that you can get to the links a little bit easier and register or learn more information. So I encourage you, if you have your phone, to take that out so you can scan those codes. Passing it over to you, Tara. I think she froze, so I'm gonna go on. So this year you can register to become a champion starting today. The form is live on our website. What a champion is you can register as a school or a community organization or business in your county to become a champion for children's mental health. What these champions are, they become part of a bigger network across the state or in your county to become an advocate dedicating to raising awareness, reducing stigma, and help provide resources in your area and community to improve children's mental health and reduce the stigma surrounding children's mental health and substance use. So the focus of participation is around annual Children's Mental Health Awareness Week, or during and around that time. As many of you may know, champions have access to digital resources, media kit pieces, and technical resources, technical assistance from us and a network of other people. So you can connect with others across the state and see what activities they're doing, borrow ideas, and figure out what you're wanting to do. So there's lots of opportunities to do that, lots of creative ways to see what others are doing. And you can scan that QR code there and register now. We're excited to bring you on board for this year. You can utilize the resources that we have on our website. The campaign's online resource directory is full of curated toolkits and activity sheets and information to support children and families across the lifespan from birth to transition age youth. That's a developing directory, so we'll continue to add more resources. If you see something that should be added to that directory, feel free to email Tara or I, and we'll be glad to add it. We encourage you to share it with others, learn about coping skills, and seek support for someone in your family or a family that you know. And we're excited to share that with you today. So that QR code is there and you can get direct access to that. So our mental wellness socials is a new opportunity that we'll be launching in January, and you're invited to participate. It's a virtual learning and networking space for families and educators, community members, advocates, and anyone wanting to learn how to support children and families in their mental health. During that 1 hour time, you'll hear from a guest speaker for a few minutes about a related topic, and then it will break you out into a breakout room. You get to choose which one to discuss the speaker topic, or you can talk about the resources that you have available to share, or other topics as well. So we'll decide on breakout rooms during that time, and it's a really unique networking opportunity. And you can ask for support for something that you may need a resource for someone that you know. So if you'd like to register for that first January event, it'll be on January 19th. You can scan that QR code there and go ahead and get registered. If you're not sure about it, you can go ahead and put it on your calendar, and we'll send out more information about that in our January newsletter as well. And then lastly, we'd love for you to plan awareness events and activities. We know it's November, May is quite a ways away, but starting in January, you'll receive a link in every correspondence that we send out to start sharing any events or activities that you're planning during or around Awareness Week, because we want to highlight what you're doing in your community. And if you do that and complete it, we'll highlight it on our website and social media and any photos that you share with us. And we want to see what good work is being done, and we want to pinpoint that. In addition to that, we will be creating a survey for you to share with your event participants as we begin to study our long-term campaign impact. So this survey will be created for you to share with folks who attend your event. All you have to do is share it. So there will be more information about that coming in January. We can't measure our impact without your help. So it's really important for you to help us do that. So more information to come. So I'm going to pass it over to Leah, who is here from Mental Health First Aid Maryland, who's going to talk to us about an opportunity with Youth Mental Health First Aid.
Yes, I did see a brief chat requesting community training. So this may be of interest to you. We are offering, in collaboration with the Mental Health First Aid Maryland program, a specific youth mental health first aid course for champions, for people who are working with and alongside the Children's Mental Health Matters campaign. This is scheduled for May 4th. So if you're interested in being in this class, taking this nationally recognized training with these like-minded champions, we recommend getting into this class, which I will drop a link in the chat and a flyer for. If you cannot wait, we do have classes monthly that rotate between the adult curriculum and the adults supporting youth curriculum, which is what the Youth Mental Health First Aid class is. So if you're interested in getting into a class sooner, I also dropped that link in the chat, but we do want to just really emphasize that this is an opportunity during mental health or Children's Mental Health Week to join champions in a youth mental health first aid class. So thank you. And Corey, we don't currently have any through MHAMD on Saturdays, but there are mental health first aid classes across the state and across the country, especially if you're interested in virtual classes, which are a little shorter. So we do recommend, if you're able to find any classes that better meet your scheduling needs, it is a standard curriculum across the United States. So recommend taking it wherever you are able to and that best meet your needs. Any other questions?
Thanks so much, Leah. If you don't mind to drop the email address for Mental Health First Aid in the chat. If anyone has questions about that, they can reach out directly to you. We're super excited to be partnering with Youth Mental Health First Aid Maryland this year to offer that for this year. It is a great training, and I would love for many of you to participate if you are. Some important dates, if you don't have the chance to take a picture of this, like I said, we'll be sending this out in an email. Champion registration opens today, so you have time, register. Our mental health socials on Thursday, January 19th. And then we have our next champion meetings with exciting activities planned for the winter and spring already scheduled. And then Awareness Week is May 1st through the 6th. Important links. There's a QR code for you for our survey. We encourage you to please take it. It is for today's event, for today's meeting. Would love your feedback. It takes about 4 minutes to complete. So I have taken it. It takes 4 minutes to complete. So please take just a few minutes of your time to complete it. And if you have any questions following this meeting, you can email me or Tara. We are happy to connect with you, schedule a one-on-one time, brainstorm with you. And then we have a fun prize to give away. So Chelsea, I'm going to invite you to share your screen so that you can do a little raffle wheel because it's fun and who doesn't want to win a prize? So someone's going to win a year's subscription to Mindful Magazine and some Children's Mental Health Matters swag.
Yes, I'm going to share my screen now.
Oh, I have to stop sharing my screen. There we go.
Can everyone see this? Oh,
It's coming.
is
Nope,
it here?
nope.
No?
There it is.
Okay. Hopefully I spelled everyone's name right. Yay, Jacqueline. You're the winner.
Jacqueline, are you here?
Thank you.
You're welcome. If you don't mind to email me, Jacqueline, so that I can get your address, that would be super helpful.
Will do.
And figure out your t-shirt size and all of that. We are happy to get that to you. So thank you so much, everybody. We are so grateful that you spent the last hour with us, and thank you for your time. And we're excited for 2023 and what it holds. Looking forward to this year. Thanks so much.